In fact, I've read that you have taken bus trips with many of your constituents to Canada. Why is it so much more expensive here in the U.S. than just across the border?
Great country. Great question. Let me just tell you that, because sometimes, you know, events happen and you just don't forget them, and this was one. I was the first member of the U.S. House to take people across the Canadian border, and the people were from northern Vermont. We took a busload of people. They were mostly women, working class women who were dealing with breast cancer, and some of them were using a drug called tamoxifen. And I'll never forget this. We went across the border. We had arranged for all of this. Went into a pharmacy in Montreal. Women were buying that particular drug for 10% of the price that they were paying in the United States of America.
Why?
And tears were coming out of their eyes when they paid for that. Because the pharmaceutical industry in this country is one of the most powerful lobbying forces. Very wealthy, very powerful. Every other major country, including Canada and throughout Europe, negotiates drug prices because they have national health care systems. So they're not going to pay top-of-the-line prices. And in this country right now, because of the power of the pharmaceutical industry, you walk into a drugstore tomorrow to get your medicine, price could be double what it is today. There are no regulations. They can charge you any price they want, and they do. And now it's not only brand name drugs, they're moving aggressively in terms of generic drugs, which are also skyrocketing. So the bottom line is the pharmaceutical industry can do anything it wants, and it is a horrific situation because I talk to doctors who work in working class communities. They say 25% of their patients cannot afford to fill the prescriptions that the doctors are writing. What sense is that? So that is an issue I've been on for a long time. We have got to regulate the pharmaceutical industry. They cannot continue to charge us the highest prices in the world. It was a very significant piece of legislation. And here's what, I am a great believer in epidemiology. And that is what we want to ascertain is what are the factors that will give people in one country, which result in people in one country coming down with more types of disease than people in another country? Why do farmers who may be handling chemicals or fertilizers come down with a higher rate of cancer or other illnesses than somebody working in an office? Why do people in the Northeast perhaps come down with problems that people in the Southwest will not have? There's a lot to be learned about environmental factors and other factors in terms of the causation, not just of cancer, but of disease in general. So if you look at the international information, you find that rates of breast cancer fluctuate significantly all over the world. Why is that? What can we learn? So that was why I did that.
What did you learn?
I learned that that there are reasons. I mean, we're still studying it. I'm not a scientist, but that there are reasons why certain people in certain parts of the world come down with illness rather than other people. And I think that chemicals and environmental exposures have an impact.
During one of your largest applause lines is when you said, when you become president, you're going to focus on creating a healthcare system that's essentially Medicare for all. Does that mean you're going to scrap the Affordable Care Act and then try to implement Medicare for all if you're president?
Well, Chuck, what it means is we are, as you know, the only major country on earth that doesn't guarantee health care to all people. I live 100 miles away from Canada. They do it. We spend almost twice as much per capita on health care as do the people of any other country. So what we want to do is expand on Medicare. Medicare is a popular, good system. It covers people who are old. I want to see Medicare cover everybody. A Medicare for all single-payer program is the way, in my view, that you provide universal, quality, cost-effective health care, and we join the rest of the industrialized world.
If you were to be elected, because honestly, I'm a Republican all my life, and I am frustrated. I'm frustrated with the choices that we have right now as far as health care is concerned. I'm fighting for my life, but it took me over a month just to get one of my chemo treatments because of the, because of the insurance that I'm on through the Obama administration. What do you plan on doing differently if you were to be elected?
What we should understand, and I fear that not every American does understand this, we are the only major, wealthy, industrialized country on earth that does not guarantee health care to all of our people as a right. The system that we have is way, way, way out of touch with where the rest of the world is. So what I will fight for is a Medicare for all. Medicare is a pretty good system. We can improve it, and we should expand it to all people. And when you do that, not only will you provide quality health care to all of our people, you will get rid of the profiteering of the insurance companies and the drug companies. Drug companies are charging us by far the highest prices in the world for prescription drugs. And when we do that, we can provide quality care for all of our people at significantly less per capita than we are currently spending. So that's my goal in terms of health care.
Mention a subject that nobody else has mentioned, mental illness. And I mean, it affects college students, affects everybody, so it's not totally out of the ballpark to speak about it here. But there's not, in Iowa, they're closing, the institutions and the facilities and not spending any money on more facilities or more help. I just want you to keep addressing that. We really need the whole, in the country, there's not enough psychiatrists, not enough psychologists. There's just not enough to really, to provide for people. People are homeless. They're in jail. I was really, maybe people won't agree with me, but I was really kind of saddened that the Aurora killer, the man who shot that 19-year-old kid, they said both sides agreed he had mental illness, he had schizophrenia. The death penalty was on the table for this man. He's sick. And I just was, why would that even be on the table for somebody who is sick? And I just think, we need to speak more because I know, it seems like mental illnesses, they're like the lepers of our society yet. They don't really get a lot of attention. And thank you for speaking up about it.
Thank you. And, I want to follow up on what you said because it's really important to me personally. And the reason I'm talking about mental health, mental illness, is because people in Iowa talk to me about it. When I started my campaign back in April, and first place I went was Davenport, then I traveled across the state, ended up in Council Bluffs. There were two issues people raised with me that honestly, as I was planning to run, I care about them, but I didn't know that they'd be high priorities. One, substance abuse, and the epidemic of meth and pills and heroin, and the fact that we've had more deaths by overdoses last year than automobile accidents. And the second, untreated mental health. And I've been talking about it everywhere. I had a town hall in Keene, New Hampshire just 2 days ago. The whole subject was substance abuse and the related issues of mental health. It was a great big cafeteria. The place was packed, standing room only, and people told their stories. They told their stories about not getting help. They told their stories about what happens when they sought treatment and there was nowhere forward, or they were put on a 6-month waiting list. I have criticized your governor for vetoing a bipartisan agreement to keep the 4 facilities that are in, as I understand it, the Iowa Code, 4 facilities in different parts of the state to care for people with mental health challenges. And the Republicans and the Democrats agreed that those 2 places should be kept open, not shut, and the governor vetoed that. Now, I read in the Des Moines Register, and I checked on it, because it was such a shocking statistic. They started transferring people, some of whom have been there for years, some of whom are schizophrenic, severely depressed, other kinds of problems. They started moving people into private facilities, and 3 of them have died since being moved. Is that right? This is wrong. This is just wrong. I don't know how else to say it. It's just wrong. First of all, there should be no difference between physical health and mental health. And we're going to learn we're going to learn a lot more as we unlock the secrets of the brain and the genome and how our body is one big, operating system. We're going to learn more about why some people are vulnerable and other people aren't. And it should not be a stigma. You know, if I had a man at this town hall that I did in Keene, New Hampshire say to me, you know, if my son had cancer, everybody would be coming up to me and telling me how sorry they are and what can they do and how is he and what's the prognosis. But if my son has schizophrenia, people don't even want to talk to me. They don't ask. They don't know what to say. So I've had some people question why running for president, I'm talking a lot about mental health. Well, because people talk to me about it. And I think a president should try to help people have better lives, help families be stronger, create more opportunities for all Americans. And I'm going to do everything I can to come up with a better approach to treating mental health problems.
But my question is, for me as a senior, my prescription costs are going up. Okay, we have a lot of young people that cannot get well and cannot get into the workforce because they don't take the proper medication. It's too high. What is your plan concerning that issue?
Thank you for raising that, and I'm sorry about your daughter, and unfortunately the story you tell is all too common. First, I will defend the Affordable Care Act. I give President Obama a lot of credit for getting it passed. You know, as some of you might remember, I tried that back in 93, 94, and I still have the scars to show for it, so I'm going to be defending it. But I also want to improve it. And one of the areas it needs improving on is prescription drug costs. The costs are going up. And there are a couple of issues here. Let me just sort of summarize it by saying we need to do a better job negotiating the cost of drugs. Insurance companies, Medicare need to do that. And one of our problems is, you know, the pharmaceutical companies are very powerful. And so far they have avoided having to negotiate their prices with Medicare, which is the single biggest payer for drugs. And I'm going to do everything I can to change that. Because it's wrong that I admit a lot of these drugs are expensive, the research is expensive, I get that. But let me tell you that the American taxpayer pays for a lot of the research that serves as the basis for the drugs being developed. We often pay for, to some extent, clinical trials, and we pay for the Food and Drug Administration, which tells you whether or not this drug can be put onto the market. So we have a big investment as American taxpayers, and then the drug companies sell it all over the world, and in advanced economies like Canada and Europe and Japan and places like that, they negotiate the prices. And then it comes to Medicare, and we don't have a law to do that. So it's going to be one of my highest priorities.
I'd like to know, first of all, health care does not cover my child's genetic issue. She was born in the wrong body, and it's not her fault. Now, I want to know how I'm going to get an insurance company to cover her surgery, a drug company to allow a decent price for that medication, and a country who will not let Smith's Food and Drug fire her because she is a girl in a boy's body.
Now, I could feel all the way over here the passion that you have as a mom, and I thank you for being brave and willing to stand up and talk about your child. I think the whole country is learning a lot more. than we did know or understand before. So I think a lot of the issues you're raising are going to have to be dealt with. And certainly as we negotiate with insurance companies and look for, the kinds of health care that people need, all those issues have to be taken into account. I will certainly do my part the best I can as president to make sure that no child, no young person is refused the care that he or she needs. And I thank you for sharing that story with us.